Sometimes life's burdens can take their toll on your emotional well-being. If you or a loved one is struggling, know that you are not alone. South Texas Health System Behavioral can help you cope with depression, manage feelings of anxiety, regain control of mood swings, and recover from substance use disorders. Our staff is available 24/7, offering the quality and compassionate inpatient and outpatient care you need to overcome life's challenges. South Texas Health System Behavioral, where your mental health is our priority. Greetings and welcome to our latest Let's Talk Mental Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of STHS Behavioral, thank you for joining us. Fundamental to your overall well-being, mental health affects your thoughts, feelings, relationships, and ability to function daily. It leads to better stress management, stronger resilience, improved physical health, higher productivity, and a more fulfilling life. So to help Rio Grande Valley residents prioritize their mental health, STHS Behavioral hosts these monthly Let's Talk Mental Health webinars. Through important education on common issues affecting the mental health of our community and strategies to address those challenges, we hope to break the stigma surrounding mental health and encourage more people to talk about their own struggles and get professional help if needed. Now, in this installment, we'll be discussing eating disorders. Marked by severe disturbances in a person's eating behaviors, eating disorders are serious mental health conditions characterized by abnormal behaviors, thoughts, and emotions related to food, body image, and weight. They do not discriminate, affecting individuals of all ages, genders, races, and backgrounds. Roughly 9% of the U.S. population will struggle with an eating disorder in their lifetime, per the National Eating Disorders Association, with 95% of cases beginning by the age of 25. Unfortunately, only 27% of those who experience distorted eating receive treatment. Left untreated, they can take a serious toll on the body, affecting its ability to get the nutrition it needs and eventually leading to harm of the heart, digestive system, bones, teeth, and mouth, even death. So to learn more about eating disorders, we're joined by Mariano Jimenez, a licensed professional counselor with STHS Behavioral. Mariano, thank you so much for joining us.
Thank you for the invite, Tom.
Now, how long have you been at STHS Behavioral?
Almost 2 years, 2 years in March.
And in that time, how often have you seen cases involving eating disorder as either a co-occurring issue or as an issue alone in the community that you see?
I've seen it several times actually, some of my patients have talked to me about, if I don't have it, I've heard from someone, a family member, a friend. So it's out there more than we think, actually.
Now, when it comes to eating disorders, they say that that number is about 9% of the U.S. population. That's about 30 million Americans will experience an eating disorder in their lifetime. Does that surprise you at all?
No, actually, I think it might be a little bit higher. Earlier today, I'm going to give you an example. One of my patients mentioned that she knew someone that for years they were going through this situation and didn't tell anybody, either for fear or for the stigma or just didn't want to disclose. So eventually they finally disclosed something, they got the help they needed. But I think the number might be a little bit higher just because people are scared or they just don't want to put themselves out there by acknowledging that there's an issue with
There is still that stigma surrounding, just like it is with all mental health, but with eating disorders, there's that stigma. And I know a lot of it obviously relates to your thoughts about your weight, your body image. We get those perceptions on television that we see. We see the magazine covers and we think we see any flaws in ourselves as an issue. So is that sort of what you have found, that it starts with that little seed of doubt in your own, in your own body image?
Yes, actually, I've been told social media, especially the teenagers, they see social media, they see creators, they see what they believe is how they're supposed to look like, or this is because they got this many followers, I should look like them, or what can I do to get to that point? So I hear social media, TikTok, Instagram, things That's what I hear.
And I know that today in one of your group sessions, so you do group therapy at SDHS Behavioral, and in one of your sessions today, you actually were practicing this presentation today, talking to your patients about eating disorders, and you said it was like one of the most fascinating presentations that you've been able to do in terms of the feedback that you were getting from your patients.
Yes, Tom, that is correct. It actually surprised me. It surprised me how my patients reacted to this group and how openly they discussed the topic, how surprised they were about the topic. Some of these disorders they've heard about. Some of them were like, I had no idea that could be a disorder. So they gave some examples of how they've seen it in themselves, but not to the extent of being a diagnosis. However, they did disclose. I do have family members. I do have people that I know that have gone through situations like this.
And there's some misconceptions about eating disorders. Many people think that it's only females, but the numbers are that about 8% of when it comes to the overall lifetime prevalence of eating disorders, it's estimated that it's 8.6% among females, but 4.7 among males. So it does not discriminate, as we mentioned earlier. Anyone can experience an eating disorder.
Yes, that's correct. It does not discriminate. Again, earlier today, one of my patients, he shared his story due to some events that he had going on in his life. He said how he would starve himself, how he would go into extremes of not gaining weight, of not being just a certain body shape, and because he needed to be that way in order to accomplish what he needed to accomplish. And it was pretty strong. Even other patients, they were supportive of each other, and they told him how he was a good person, how he was good. You know, he was good enough just being the way he was. It was pretty nice to hear that.
Yeah. And now when it comes to age, I know that we talked about that most of them develop by the time that you're 25 for most people. So that we're talking about children, teenagers and adolescents and young adults. Does it surprise you that population is so prone to begin experiencing those eating disorder symptoms?
I deal with adolescents at the hospital, and the situations they find themselves in, the emotions they go through, the need, they're like, well, if I cannot get the attention I need or what I need from my caregiver, then I have to do something about it. You know, what can I do? How can I get those needs met? And I've had some of my patients tell me, you know, like I do things like this in order to get noticed, you know, because they don't like not being noticed. I mean, who does? And it doesn't surprise me. I mean, it starts young. You get that image of the perfect person you see on TikTok, like all this. So it doesn't surprise me.
Yeah, it's hard to beat the body image, mentality that we have, what we may be thinking about ourselves, and it isn't necessarily what reflects out in the community when you see other people, because you get a compliment, you're a little surprised by it, but everyone is perfect the way they are.
Yes, that's true. That's why I mentioned it was nice to hear other patients supporting this male patient. When he was sharing his story, he was like, you know what, hey, you're good. You're good the way you are. You're perfect. You shouldn't change anything. And he felt it. You can tell when he received that message, he felt it, and everybody it was a very good thing to experience in the group.
That was good that you had a very successful presentation to your patients, and now you're going to present to our viewers right now a great presentation that you've put together. So let's get started.
Yes, Tom. So eating disorder prevention. So what's an eating disorder? Eating disorders are complex medical illnesses that have serious physical, mental, and physiological and psychosocial consequences, as well as association with high mortality rates. Eating disorders involve an unhealthy relationship with food and cause significant interference with daily functioning. Some examples of eating disorders include anorexia nervosa, atypical anorexia nervosa, bulimia nervosa, binge eating disorder, and avoidant restrictive food intake disorder, also known as ARFID. So common eating disorders, the ones that a lot of people have heard about the most are anorexia nervosa, the bulimia nervosa, and binge eating disorder. Anorexia nervosa is characterized by a significant, persistent reduction in food intake, leading to extremely low body weight in the context of age, sex, and physical health. A relentless pursuit of thinness, a distortion of body image, an intense fear of gaining weight, and extremely disturbed eating behavior. Many people with anorexia see themselves as overweight even when they are starved or severely malnourished. This is something that we saw a lot today this is one that identified a lot of the patients. Like, this is one that we see, this is one that we hear about, and this is one of the, I guess it's more heard about out in the community, out in social places. There's one, and the next one actually, bulimia nervosa. Bulimia nervosa is characterized by binge eating, eating large amounts of food in a short time, along with a sense of loss of control, followed by a type of behavior that compensates for the binge, such as purging, vomiting, excessive use of laxative or diuretics, fasting, or excessive exercise. Unlike anorexia nervosa, people with bulimia can fall within a normal range of their weight, but like people with anorexia, they often fear gaining weight, want desperately to lose the weight, and are intensely unhappy with their body size and shape. So there's a difference between both of them, the anorexia and the bulimia. With anorexia, they lose a lot of weight and extremely fast. In bulimia, they might still be within their weight range, but it's still affecting them. And the third one that I've got a lot of input on is binge eating disorder. It's characterized by recurrent binge eating episodes during which a person feels a loss of control and marked distress over his or her eating. Unlike bulimia nervosa, binge eating episodes are not followed by purging, excessive exercise, or fasting. As a result, people with binge eating disorder are often overweight and obese. This is another one that one of my patients shared earlier today with binge eating, and there was a group discussion that had to do with this specific disorder, where one patient was like, well, if I like to eat, I can eat. And another patient was like, yes, that's okay, but not binge. Don't binge, don't just do it because there's nothing else to do. The topic of depression came into the picture. It was a very interesting conversation that the patients brought up upon themselves. But these three are the main ones that you hear about. What can anorexia nervosa lead to? It can lead to fatigue, fainting, slow heart rate, low blood pressure, and could lead to heart failure. In bulimia nervosa, dehydration, tooth decay, acid reflux, and could lead to inflammation and rupture of the esophagus due to the person purging, vomiting, forcing themselves to vomit. And binge eating disorder can lead to high blood pressure, high cholesterol, cardiovascular disease, and diabetes. Like you mentioned earlier, Tom, these disorders not only they're not only mental illnesses, mental disorders. However, because they also affect your overall health, your health overall, and they do affect more than your mental health. This is the slide I was talking about a little bit earlier about the characteristics of anorexia nervosa, characteristics of bulimia nervosa, and binge eating disorder. However, there are even more eating disorders in the DSM-5 TR. One that some people could have heard of is pica. Some of my patients mentioned they didn't know what pica was. They mentioned some TV shows they had seen depictions of this disorder in the TV shows, in how a person with diagnosed with pica can eat non-food, non-nutritional items. They can eat cotton balls. They can eat wood. A patient mentioned, oh, the drywall from the wall itself at home. So that's another one in the DSM-5 TR. You also have rumination disorder, avoidant restricted food intake disorder, and unspecified feeding and eating disorder. Avoidant restrictive, it means that you don't eat. You want to starve yourself due to not gaining weight, not wanting to gain weight. And then unspecified feeding disorder and eating disorder means that there is some type of disorder there, something going on, but the patient does not meet any of the criteria from the other that were already mentioned in the presentation. Now the causes. This is where a lot of what happened, what makes this the patient or the client be involved in these behaviors. Genetics. Some people may have genes that increase the risk of developing eating disorders. And their biological composition in the brain. The changes in brain chemicals may play a role in eating disorders. Frequent diet and starvation. Diet and the risk factor, it increases the risk factor of eating disorder, especially when the weight gain is constantly going up and down. They're trying to maintain their healthy weight, or what they consider their ideal or healthier weight for themselves. So dieting, excessive dieting, and starvation. History of weight bullying. This was another topic of conversation today in today's group. Weight bullying. People who have been teased or bullied for their weight are more likely to develop problems with eating and eating disorders. When this person is shamed or called names because of the way they look, their body shame. It usually starts young, teen years, maybe middle school years, and this person internalizes what they're being called, they're being said they look like, and it takes a toll on them. So this can also lead to eating disorder. And stress, just heading off for college, moving, landing a new job, or a family relationship issue, change can bring stress, and stress may increase the risk of eating disorders. So stress can be anything, and the students that graduated high school and going to college, that can be stressful enough that can start an eating disorder. Just moving to a new place, moving to a new city, a new state, starting a new job. You don't know what to expect, so you compensate by either restricting food or overeating. Family and relationship issues. If we feel that we cannot do much about the situation, we compensate with other behaviors such as some type of eating disorder. So women in disordered eating. While most older adults with eating disorders have had symptoms since adolescence, life transitions and stressors common in adulthood, such as children leaving the home or menopause, can make eating disorders much worse. Again, it's a life change, it's a life transition. Children going off to college, it can affect the kids moving off to a different cities, different states, starting college, but also can affect the parents. Going through the life change as menopause can also affect the females. Among women over 50 and over, 71.2% say that they're currently trying to lose weight. And 79.1% say their weight or shape had a moderate effect on or while most older adults with eating disorders have had symptoms since adolescence. Life transitions and stressors coming in adulthood, such as children leaving in home and menopause, can make eating disorders much worse. Any type of change, and we talked about it earlier, any stressor can create that need to compensate with a different behavior, or more, can say an unhealthy behavior. just to compensate for what is missing, for what's not going on. Among women over 50, over 71.2% say they're currently trying to lose weight. I've heard this number a lot during my time in the hospital. They trying to still look younger, still trying to look, be that a model to either a loved one, to their kids, like I'm trying to take care of myself. And it's okay, you want to take care of yourself, just do it moderately, being insightful on what you're doing to take care of yourself. And 41% of women over 50 have current or previous core eating disorder symptoms, divided into 13.3% who have current and 27.7% past symptoms. So at one point, a woman can exhibit the symptoms or some type of the symptoms, but not get to the point of getting that diagnosis of an eating disorder. And it's not women, we can talk about men here in a little bit. That's something that was brought up earlier today in group as well. It was a female patient. She's like, well, I thought, I believe she said she was 16 or 17 years old, and she thought that she might have had a eating disorder because she liked having plastic in her mouth. She liked to chew plastic, and she's like, I never ate it, but I like the feel of it in the mouth. Eventually, she stopped. And other group members were like, no, we easily consider it an eating disorder if you never actually ate it. So she was like, well, I guess not. But she shared a little bit of that. Now for men represent up to 25% of people with eating disorders. Even so, women are up to 5 times more likely to be diagnosed and 1.5 times more likely to be treated for an eating disorder than men are. So even at that is a pretty high number, 25% of people with eating disorders. Men with eating disorders tend not to recognize their symptoms as problematic, in part due to the stereotype of eating disorders being a woman problem. We see this not only in in eating disorders. Men would try to either keep things to ourselves, not talk about it, keeping that front of, well, we're the strong ones, or I cannot have an eating disorder because, well, I'm not a woman. That's a woman's problem. So it goes back to not disclosing what's going on, and that's why I said earlier today that 9% number could be even a little bit higher due to men and other women not disclosing that there's an issue going on. By the time men with eating disorder symptoms present in healthcare settings, their cases tend to be more severe, in part due to their denial of symptoms, anticipated or encountered prejudice, or even denial of treatment because of their men represent up to 25% of people with eating disorders. We saw a little bit of the health issues that can be caused by eating disorders. And we mentioned in the bulimia nervosa, the rupture of the esophagus, something that can be prevented if the person seeks help early. If we wait to that point, it might be too late. It might be the other complications that may come up from not seeking help early enough. For teens, adolescents, and disordered eating, there's some mental health concerns that often occur in individuals with eating disorders. They include social isolation, loneliness, significant anxiety, withdrawals, depression, and suicidal ideation. We talked about weight bullying earlier, and this is more with teens. We see more with teens, and that's when they decide to, you know what, I won't go to school. I'd rather stay in my room. I'd rather stay at home. I'd rather just be alone. Nobody likes me. I'm not pretty. I'm not attractive. Okay, or because they're being bullied at school, so they try to they seek social isolation, being alone, a lot of anxiety, withdrawing from friends, from family, depression, and it can go up to suicidal ideation. Some common symptoms to look out for in adolescents are rapid weight change, low heart rate, hormone changes, fatigue, fainting, breathing problems, hair loss, blood pressure changes, heart rhythm abnormalities. If you see a teen always being tired, they lose weight drastically. They take them to a doctor and they're like, oh, there's blood pressure changes too low, or there's something going on with the heart. Yes, those are health and physical problems, but it might be a good idea to get maybe a screener for a eating disorder. So it's important to remember that eating disorders are both medical and mental health disorders. So it is incredibly difficult for children, teens to recover on their own. They need treatment and consistent support from their families. Unfortunately, a child, a teen cannot go to seek medical help on their own. They need the support. If there's anything that you notice with your child or teenager that might be going on, hear them out, listen, ask them how they're doing, and if they ask for help, give it. Take them to get checked. We should not be afraid to closely monitor the child or teen's eating behaviors. Parents should be ensured their child is eating the variety of foods and obtaining adequate nutrition each day. Talking to them, communicating, keeping an eye on what they're eating, how they're eating, how much they're eating, when they're eating. You know, it's just something that as a parent we can do to help our children and adolescents. And some of the treatments that we've done there in the hospital to help our patients and with eating disorders is cognitive behavioral therapy. It focuses on identifying the distorted thought patterns regarding body image, weight, and food. So cognitive behavioral therapy changes the way you think, you behave. So what happened? What made you look at yourself in this way? Right? What can we do to change that? What can we do to help you cope when you ever identify what's going on, what triggered you to do these behaviors? How can we help you to cope and move on in a more positive way? And dialectical behavioral therapy. It teaches them teaching skills, mindfulness, distress tolerance, interpersonal effectiveness, and emotional regulation. Just being mindful and at the moment, in that moment, what's going on? I know something changed, I feel a certain way. What's going on? What changed? Distress tolerance, being able to cope with the stress or what's going on, if they be with the emotions, the flood of emotions coming through your body and you're feeling, being able to manage them. How to the interpersonal effectiveness, emotional regulation. Again, focusing on the emotions, focusing on ways to manage that the reaction to the emotions in a more positive way.
That is great information, Mariano, that you've been able to share with us. And we did go over those numbers and we were talking about some of those statistics, but it's really important to really drive it home that it really is a serious issue. Mm-hmm. So every 52 minutes, one person dies as a direct consequence of an eating disorder. So they are potentially lethal. That is what's really important to recognize, is that if you are starving your body or you're not giving it the nutrients it needs, your body will shut down, and eventually that could lead to some serious complications, even death.
Yes, sir. Yes, we mentioned some health risks, but it can lead to death. Yes, that you're right.
And that's why it's really important to be on the lookout for any warning signs and symptoms and have those important conversations with your loved ones, with your family members, with your friends, if you suspect that they are engaging in any sort of behavior that indicates they could have an eating disorder.
Mm-hmm. Yes. If you see any drastic weight change, anything that you might see that it's not normal for them or to behave in that certain way while eating or not eating, or ask the question, hey, how you doing? Hey, what's going on? Hey, how can I help you? What do you need from me right now? It lets them know that they're seen and there's someone that cares, and that there's things that can help them.
Mm-hmm. And we talked about men and eating disorder statistics. So people currently living in the U.S., 4.0% of males, that's 6.6 million people, had experienced an eating disorder at some stage in their lifetime. And rates of eating disorders in males are increasing at a faster rate than females. So that's one thing that is a little surprising, especially because we see social media and the impact that it's having on the younger generations, and that body image that we're witnessing, and how it affects our own body image, and those perceptions of beauty that are out there. But men, is it surprising to you to see that it's rapidly increasing for men versus women?
No, actually it's not surprising. I mean, men also use social media, so they have people they see, other men that may be physically fit, or I want to have that body type. What can I do to get to that point? Maybe if I starve myself, I can lose some weight, and then I can start from the bottom to gain muscle. There's a lot of things that in being a man, like you still see like that. I want to look good. I want to feel good. It's just there's a wrong way of doing it, and there's a right way of doing it, and we need to understand that difference.
And then because of those misconceptions that it is more of a female issue, men do experience a delay in recognizing their behaviors as possible eating disorders. So they may just think, oh, I'm just not eating today, or you know what, I'm gonna throw up I'm gonna purge what I just ate, but they may not recognize that that's an eating disorder symptom.
Yes, one of my patients actually mentioned that he's like, well, that's normal for me. They're like not eating for a day, 2 days, 3 days. I think the longest I've gone for is a whole week without eating. It's like, but that's normal. I wasn't hungry. I was able to still go to school, still function, still go to work. So that was normal. It wasn't until, he said it was his mom that was like, hey, I went to buy you pants and they don't fit you anymore. So he's like, there was something going on. And but I still today, he's like, I didn't think that was, it was difficult for him to accept that there was something going on, even at that point. He's like, but I did it for my mom, so I started eating a little bit often, and she made sure that I would eat. And he's like, but yeah, like, you don't see it as an issue, you don't see it as a problem. And that's why men take longer to go seek the help that is needed.
And one that I found surprising when I was looking at the research was military and eating disorders. So a 2021 study found that approximately 1/3 of women and 1/5 of men in the veteran population reported symptoms consistent with a DSM-5 eating disorder diagnosis. And I know that the mentality, especially in the military world, like, you have to be fit and strong, there is that mentality. So I can see where that could potentially lead to somebody experiencing an eating disorder.
Yes, there's a lot of requirements, fitness tests, your body fat level. There's a lot of things that go into being a military. If you're overweight, you put in a diet program and all these things. So it's like, you know what, I don't want to do that. It's gonna take time off my day, and I'd rather be tip-top shape to do that, whatever my job is, and not being asked to do extra at the end of the day. That actually surprised me too. I was not aware of that, and but it's interesting because I can see maybe a correlation of physical fitness, starving or extreme dieting to get to that goal.
And another one that surprised me with athletes. So the prevalence rates of eating disorders have been shown to be higher in athletes compared to non-athletes, and have been found to range from 6 to 45% in female athletes and 0 to 19% in male athletes. So it's, again, comes to that fitness level that you want to be. You want to make it to the varsity team. You have to be in tip-top shape to be able to perform. And so you may turn to an eating disorder to get to where you need to be. You may avoid eating altogether.
Yes.
You may eat and purge, or whatever it may be, but it does affect our athletes as well.
Yes, one of my patients, actually, he's an amateur boxer. He's like, well, sometimes I have to watch what I eat. Most of the times I watch what I eat, but sometimes I have to use laxatives to make that weight class, because that's the weight class I want to stay in, and is my maybe I'm not ready to move up a weight class, or I want to go down a weight class, or in two weight classes. So it's like I tend to do it on my own, but when I need help, it's like I have used laxatives to get to that weight level. So yes, athletes are affected. Athletes are still they're still people. They still have to maintain a certain body image, whole physical fitness, as well as like with the military. So sometimes they go to use things like laxative or diuretics to be able to meet that weight class.
And when it comes to eating disorders, sometimes they co-occur with other mental health conditions. So one of the things that they do find is that there's also substance use disorder that occurs. So that could be an addiction to alcohol or to drugs. When it comes to having that eating disorder, and it says that 50% of individuals with an eating disorder use alcohol or illicit drugs, compared to approximately 9% of the general population. So it's a much higher statistic that we're talking about. And so it's again the feelings associated with it, and your thoughts and your thoughts about food and all impact your mental health, that you turn to other substances.
Yes. Not too long ago, I had a patient tell me, well, I wouldn't eat because I wasn't hungry. That's what she would say. I wasn't hungry, so I wouldn't eat. So eventually I started smoking marijuana. That way I would get the munchies, like they call it, and that helped me eat. So she didn't see either not eating or her substance use as a problem in any situation. We worked with her for a little bit. She kind of like, well, maybe I can do something different to get me to eat a little bit more and not just rely on smoking marijuana to be able to eat. It was kind of interesting because, yes, like you mentioned, there's a lot of co-occurring disorders, especially with substance use and the eating disorders. And seeing it firsthand from a patient telling you, like, yes, I don't eat, so I have to smoke something to be able to give me that urge to eat. It was interesting to hear.
And then you touched on suicidal ideation, and I know that suicide prevention, suicide rates are high especially in certain populations, including that younger population. But suicide is one of the leading causes of death for those diagnosed with an eating disorder. So it's really important to recognize that, yes, it's physically affecting them and their bodies, and could lead to body shutdown of some sort, your kidneys, your heart, like it could affect you that way, but also your mind, and it could lead to that suicidal ideation, which is really dangerous, and you need to catch right away to make sure that you prevent anything from happening.
Yes, not eating it can be connected to, like, when a person feels depressed. I don't want to get out of my room. I don't want to eat. What's the point? There's a lot of things going on. I cannot change anything. There's a lot of things that go into those thoughts that lead to maybe not wanting to eat. Or whenever you're trying to lose the weight and you're not able to, especially in a younger age, you're not able to meet that expectation. I've heard teenagers tell me, like, I used to just eat crackers and water. It's like, just because my family members told me I'm fat. It was like, and I wasn't able to, and to meet the expectation. So yes, the thought of suicide did cross my mind. It did cross my mind. It wasn't until a counselor at school asked me, like, hey, what's going on? You know, and she straight up asking me, like, are you thinking about killing yourself? It's like, and that's when I was like, whoa, I need to put a stop to this. Like, it allowed me to take a break, take a step back, and see, like, what else can I do? And like, thank for that. She was very grateful for that counselor. She was like, thanks to her, I got the help that I needed, and I'm still here because I didn't think I was gonna make it past that semester. And but yes, suicide ideation, it can be caused for many things, but eating disorders can be a huge factor. Yes.
So when it comes to supporting somebody and ensuring that they get the treatment. Early detection is key to hopefully reduce the harm that you cause to the body and the mind. And so let's talk about some of those symptoms that you'll see when it comes to anorexia nervosa. So over time, some of the following symptoms may develop related to starvation or purging behavior. So your menstrual periods cease, dizziness or fainting from dehydration, brittle hair and nails, cold intolerance, muscle weakness and wasting, heartburn and reflux, especially in those who vomit, severe constipation, bloating, and fullness after meals, stress fractures from compulsive exercise, as well as bone loss, resulting in several issues, including osteoporosis, and depression, irritability, anxiety, poor concentration, and fatigue. So you're starting to see how it impacts the body physically and mentally with the menstrual periods ceasing, the dizziness, as well as the brittle hair and nails. So looking for those signs, those are the warning signs that you need to be looking out for.
Being, especially with it's a loved one, that we know our loved ones are the best, right? So we start seeing some changes on loss of hair, or if your daughter tells you like, hey, I haven't gotten my period, and or you start noticing whenever you shake hands, little things like the nails, it's important to bring it up. It's like, hey, are you okay? Being able to let them know that they're able to communicate when there's the need for help.
Now, when it comes to bulimia, here are some possible signs that someone may be experiencing bulimia, and that's so frequent trips to the bathroom right after meals, so that's a telltale sign there. Large amounts of food disappearing or unexplained empty wrappers and food containers, chronic sore throat, swelling of the salivary glands in the cheeks, dental decay, so you'll notice some issues with the teeth, heartburn and gastro reflux, laxative or diet pill misuse, misuse of diuretics, so water pills, and feeling dizzy or fainting from excessive purging behaviors, resulting in dehydration. So the body experiences that dehydration, you start experiencing those issues. So some similar symptoms to anorexia, but you're also seeing behavior changes. So going to the restroom right after a meal, disappearing for a little bit.
Yes, I heard that one earlier today. He's like, well, if a person wants to induce themselves to vomit, they don't do it in front of you. They'll excuse themselves and leave. So you don't know if there's an issue. It's like, well, you can keep an eye on that. Are they doing it regularly? Every time do they eat? Every time they have something to snack? Do they go to the restroom? Just ask. It's like, are you okay? There might be something else, but it's not too hard just to ask. Hey, are you okay? Is there something going on?
Yeah. And then obviously it's paying attention to the medicine cabinet as a parent, because if you do have laxatives that you may have or any sort of medicine for an emergency, and you notice that supply is disappearing without you using it as often, there may be a warning sign there that you need to be looking out for.
Yes, sir. You can answer like, what's going on? I just refilled this prescription, it's already gone. Or I just bought this medicine, is already gone. Yeah, keep an eye for that too.
And we talked about binge eating earlier, and obviously eating more rapidly than normal, eating until uncomfortably full, eating large amounts of food when not feeling hungry, eating alone because of feeling embarrassed by how much you're eating, feeling disgusted with yourself, depressed, or very guilty after a binge. So those are some of the behaviors to look out for that you may see.
Yes, binge eating is eating when you're not hungry, like you mentioned, right? If you see your someone or loved one or someone they just finished dinner, and then they're already looking for a snack. They're already looking for what are we having? What's next? What can I eat? It can be a sign that like there's something going on. Again, it doesn't hurt to ask, is everything okay? Like, do you need to talk to someone? And you might get some pushback. It was like, oh, just because I like eating doesn't mean there's something wrong with me. But you asked, okay? And if there's something going on, it allows them to see again that there's help, that there's someone that cares about them.
And the really important thing to remember is that recognizing those warning signs and symptoms of an eating disorder and seeking help early, so early treatment, will greatly improve the chances of recovery. And that's the important thing to remember, that as soon as you see something, say something.
Say something, yes, yes. As soon as you see something going on, something different, a change in behavior, a change of, mainly a change in behavior, say something. Again, early treatment prevents a lot of possible side effects, both mental health, both physical health problems in the future. And it is like everything else. Every other disorder, every other mental illness, same thing with physical symptoms. You see something change, seek help. Go get yourself checked out. Go get a screener. That way you can rule out what is not and get the help when you need it.
So how are eating disorders evaluated and diagnosed?
Well, there's a lot of self-reporting, one, and another one is someone else, like a family member or loved one sees it. We can get some collateral information from that. We can ask how long the symptoms have been present, how long have you been doing this behavior. So
you're basically assessing the patient. You're doing an assessment of the patient. You're just trying to determine the information you need, and then from there you do a medical exam. I'm sure as well, because you're looking at some of those impacts that the body may experience because of the eating disorder.
Yes, you do an extensive assessment of the patient, asking all the questions you need to know, and yes, you can also send for a medical exam to get them evaluated to see if there's anything else going on in the body that needs attention for the medical team.
All right. Now, once a person is diagnosed with an eating disorder, you talked a little bit about treatment, and the two types of treatment that you talked about were basically the cognitive behavioral as well as the dialectical behavioral therapy. So getting that treatment is key. Do you know of resources in the community that are available to sort of help people who may need treatment?
Well, there's our hospital in South Texas Behavioral, and while I'm looking for information for this interview, this presentation, I was not able to find local information. I know that a long time ago I heard of a Weight Watchers program and all that stuff. You know, people that are trying to go healthy eating and stuff. But there are national organizations that do provide some services. They have information, so I'm pretty sure there's some local chapters of those organizations here or close to the valley.
But do your research. I know that there is the National Eating Disorders Association website. They had some great resources on there, but it really is important to at least speak for the physical, working with your doctor, obviously, and all of the impacts that it may have had on the body. But speaking with a therapist, getting a counselor or a therapist to talk, so that you have the mental part as well, because I think it comes down to understanding what was causing the eating disorder. An eating disorder doesn't just happen. No, there's something that leads to it.
Yes, it doesn't just come out of nowhere. It's something that triggered that behavior, something that happened, that some change. I like to tell my patients is like, don't ask why am I doing this, right? Don't put yourself in that spot. Don't say why. Ask yourself what happened, what triggered me to behave this way, what triggered me to act this way. Something in the environment happened, something in the environment changed, or made you think that you needed to protect yourself or that you needed to change something that led to that behavior. So don't ask yourself why, ask yourself what is going on that is affecting me in this way.
And when you're talking about recovery, there are 3 areas that you really need to understand. And that's, first of all, physical recovery. So the body needs to recover from the damage that was caused by the eating disorder. The second one is your behavioral recovery. And then the third one is your psychological recovery. Which one do you think is the hardest one for a person who is recovering from an eating disorder? Do you think it's the psychological?
I want to say it's the psychological, just because the behavior is reinforced by what we get from the community or from loved ones or from the outside, right? So if we've been told all these many years, like, oh, you're fat, you're never gonna get married, you're never gonna be loved, it's like that is ingrained, that's really internalized. and it's hard to break. That is the most difficult thing that I think a client, a patient can get through. Just being able to break from those chains. Being like, I've been told all my life that I'm this. It's like, maybe I am. You know, they accept it. So when we try to work with them to be like, no, we can change. What can we do to change? It's like nothing. This is the way I've been my whole life. So this is me. So I think the psychological aspect of it is the most difficult to break.
And how important is a support system? So having your loved ones, your family, your friends, those close to you, being there to support you and help you on that road to recovery.
Yeah, it's very important. I tell my patients this, because a lot of our patients are like, well, I have you guys to help me out. It's like, great, we're here to help. But what about when you leave? What about at home? What about friends? How about family? And it's important to have one person. I tell them one person that you can call, that you can text, that you can email, however you communicate with them. And they will respond and they're gonna be there to support you. One person, it's a lot. If you have more than one person, great, that's excellent. But if there's one person in your life that you can trust enough to tell them there's something going on, that you need the help, that can be a difference between going through it alone and getting the help that you need.
Now, we talk a lot about the effects of media, obviously, and you talked about how social media, your patients today, we're talking about all of those images they see on Instagram, on X, and on Facebook. They're seeing all of these images. They're going to the newsstand and they're seeing magazine covers of beautiful people. So obviously, the media has a big effect. So when it comes to making sure that we're not letting it impact us so much and those effects, some of the things that we can do is obviously choose and use media mindfully, right? So you should, I know we have doom scrolling that happens now, and you're on TikTok and you're just going from one to the next video, but you should choose and use your media mindfully, right? Pay attention when you're being mindful of what you're watching.
Yes, one patient mentioned today, like everything that is on TikTok and on Facebook is like, it's not real. You know, they take probably 20, 30 pictures to post the perfect one, right? They do changes, they do all these edits on the pictures. It's like, it's not real, like don't fall for it, right? And there were some patients like, well, but I want to be like them, you know, it's real to me. So if I see it, I want to be like that, yes. So there was one patient that was kind of like, no, it's not real, don't fall for it, because they might have means that you don't. They might have the professional camera. They might have all these things that they can work with the pictures, and you don't. So yes, they're gonna make themselves look good, but you're gonna make yourself feel bad.
And another one is obviously limit your screen time and social networking. And this relates to parents for their kids, and you, if you may be dealing with some body image issues or an eating disorder, you really need to limit your screen time and your social networking and make sure that you're protecting your health.
Yes, for kids, it'll be like, hey, an hour of screen time, to me is a lot a day, but they put limits. Is like, oh, what are they watching? Know what they're looking at, what they're scrolling through, what message are they receiving from those images. You can ask. It's like, hey, I saw that you were watching this video. It's like, what do you think about that video? You get a sense of where their mind is going to, and limit and ask questions. It's like there's something where you're gonna be able to see when there's something impactful on the phone or on the tablet or on the computer, because you're gonna see a behavior change on your child or your adolescent or your friend. So you can keep an eye for that, keep an eye out for that, and because you'll be able to notice it.
And it can be a challenging experience for a parent or a loved one to provide the support that the individual, that the patient needs, who's dealing with the eating disorder. So it's really important to make a point to express love and acceptance of that loved one, of your child, if it's your child, or your family member. Express that love and acceptance of them, because that's really important, right?
Yes. Being non-judgmental. It's okay to ask the questions. It's okay to ask for information and to meet them where they're at, but doing it non-judgmentally. Again, not asking the why, but asking is like the what. What is going on? What is causing this? What can I do right now to help you? What do you need from me? Not the why are you doing this? Why are you watching this? Why are you behaving this way? that the why question is very, it's already setting blame. It's already telling you you're doing something wrong.
Yeah.
And especially for a teen or a child, that's not what they need to hear at that time. It's like, what is it that I can do to help you? What is it what that I can do? What is it that you need from me right now? I think that's the question, is like, what is it that you need from me right now?
And some other ways that you can help is encourage and participate in the initial evaluation. So that's really important to be part of the conversation that is initially had. Meet with the nutritionist so they can help with nutrition education and counseling, and if indicated, creation of a meal plan. So that's really important to be involved in that, especially if you're a parent of a child or a teenager that is experiencing an eating disorder. Eat meals as a family, and I know that we don't do that as often as we should. So sit at the table together. You're able to see a lot and discuss a lot when you're at the table as a family, right?
Yes. You can talk about a lot of things at the table, and yes, you're right. I don't think we do that enough, either because kids have homework, there's other errands to run, or we're watching a TV show in the living room and someone else is in the table. There's a lot of things that complicate that, right? But taking the time, and you mentioned being present for that initial evaluation. We talked about it earlier. A lot of us, we don't see it as an issue. So we might be like, no, everything's okay. That's normal for me. If you're present in an evaluation, it's like, hey, you know what? Yeah, it might be normal for you, but that's not really normal. You know, that's not something that just everyone does or doesn't do. So being present, being able to, one, show the support that you're there for them, but also being able to provide some collateral information of what else do you see that your loved one hasn't been able to see for themselves.
So for anyone who may be watching who is experiencing an eating disorder, what advice would you want to tell them right now?
Ask for help. There's help. Don't let the stigma get to you. Don't let that keep you from asking for the help that you need right now. It is okay. It is okay to ask for help. You're not alone. You're not alone. There's a lot of people there that are going through it alone, but you're not. Okay, so just ask for help. That's my message. And
for a family member of somebody who may be experiencing an eating disorder, what would you want to tell them?
Support. Be there. When someone tells you there's something going on, don't judge. Don't ask the why. Why are you doing this? Ask the what do you need from me right now? What's the next step? Where are we going after this? Just be supportive. Be supportive. Don't judge.
And help is available.
Yes.
There are resources online that you can find. STHS Behavioral as well. They can call they can call the 388-1300 number, and they can speak with a counselor 24/7, right? Help is available.
Yes, it is available, sir. It is available. You just need to ask.
Ask. Simply ask. Take that first step.
Yes, sir.
Alrighty. Well, thank you so much for your time, Mariano. We really appreciate it.
Thank you for having me.
And that officially concludes our webinar. We thank you for joining us. We hope you'll continue to prioritize your mental health and the mental health of your loved ones. If you're experiencing a mental health challenge, STHS Behavioral can help. The facility has served the South Texas community for more than 30 years, offering inpatient and outpatient treatment options. If you or a loved one is experiencing a mental health issue, you can schedule a confidential assessment by calling our hotline at 956-388-1300. Please remember that you are not alone. Speak with a loved one or seek professional help if you need emotional or mental health support. And if you are experiencing a mental health crisis, please call the National Suicide and Crisis Lifeline at 988. Licensed counselors are available to speak with you in English and Spanish 24 hours a day, 7 days a week. Now, don't miss our next installment of this Let's Talk Mental Health series on Thursday, March 5th, when we will discuss at 5:30 p.m. right here on Facebook. We will be discussing alcohol use disorder. We hope you can join us. And to watch our previous Let's Talk seminars, all you have to do is visit sthsletstalk.com. Until our next webinar, stay healthy, stay safe, and please continue to prioritize your mental well-being. Sometimes life's burdens can take their toll on your emotional well-being. If you or a loved one is struggling, know that you are not alone. South Texas Health System Behavioral can help you cope with depression, manage feelings of anxiety,